Hello, I'm Joyce. I'm one of the core trainees rotating in cardiothoracic surgery. So today I'm going to give you an overview or a quick tour of my department in cardiothoracics. Welcome to 5A. This is the cardiothoracics ward, and in the next few seconds we will find one of the consultants, that's Mr. Jagannathan, doing his ward round.
So 7 milligrams of warfarin. His antibiotics finish on the 9th, and his bloods and everything are fine. His X-ray is fine. He's having echo. He should get a repeat echo book for this Friday. And if it's gone, if it transfers to the Ulster, then let them know as well. What about ophthalmology? What's happening with that?
It's a kind of syndrome, vague glaucoma syndrome.
It's a normal tensive glaucoma. So I think just make sure that Ulster knows to follow it up.
Yeah, they just want a referral sent to the glaucoma clinic and
Okay.
they will follow it up.
Okay. And the CT brain was fine.
CT brain and
Any idea when it's going?
well, they say that will fail in the next 2 days. They have 5 people coming in today, so
That's fine. He's not.
116 is wanted.
Okay, I'm just doing.
So I'm here today with my colleague Dorina. She's one of the core trainees in Royal Victoria Hospital Cardiothoracics department. So she's gonna give us a little insight why she chose to be in this department.
Well, I wanted to do some sort of specialized surgery. It's one of my, what do you call it? One of my fascination, if I could say so. Also wanted to always see how the bypass machine works. It's been quite a great experience. We've managed to go into theaters as well and see a few cases, do bits and bobs, which is always fascinating to see bypass surgeries and other valve surgeries. On the ward, it's quite busy, but time goes by fast.
Now that you have seen what we are doing in the rounds and have heard Dorina's input on things, now let's have a quick chat with some of my consultants.
Hi, my name's Gwen Beattie. I'm one of the heart surgeons in the Royal. I picked medicine because I love science and I love people. And then I ended up doing work experience here in the Royal with one of the chest surgeons called Jim McGuigan, and I loved it. I spent lots of days on the ward with one of the junior doctors, following around and helping them. And then I got into theatre with Jim McGuigan, where I was able to see people's lungs being removed who had cancer within their lung. That was what really did it for me. That was gave me the understanding that this would be something that I would enjoy. And I really am supportive of you guys coming to do work experience because I got so much out of it at your stage. I picked cardiac surgery really because I loved seeing the immediate effect that our operations have. So patients would come in to the clinic, they would get short of breath walking from the chair to the seat beside you, and you could see that they look sick and unwell. You do the operation, and then afterwards, even though they've got a scar down the front of their chest, they tell you that they feel better. Patients are always really grateful, and you see that immediate benefit of how fixing their valve can help somebody's quality of life pretty quickly, but also you're prolonging their life and you're actually relieving the symptoms. And that for me is the thing that makes my job worthwhile, and I really enjoy it.
Hi there, I'm Rory Beattie. I'm one of the thoracic consultants here in the Royal. So what do? I look after all surgical problems in the chest, that's not including the heart really. So our main work is lung cancer, trauma, or dealing with people with collapsed lungs. Why did I choose this? Well, really, it kind of combines physiology, cancer, and then you're operating on some of the sickest patients, doing major surgery and trying to, for most of the case, in the cancer patients, trying to cure them of cancer and doing major operations and getting them out of hospital as quick as you can. So it is very rewarding.
Hi, I'm Mark Jones, a cardiothoracic surgeon, also a training program director for cardiothoracic surgery. Cardiac surgery is a fascinating specialty. We get to treat a number of diseases of the heart, diseases both on the surface of the heart with coronary arteries, diseases of inside the heart with a number of valves, and also disease affecting some of the great vessels. The aorta in particular, where it comes out of the heart, can be affected. It's a very rewarding specialty, however, to see the transformation of patients. I was fascinated in the anatomy and physiology of the heart as a medical student. I had the opportunity to go and work in South Africa in a trauma unit and also see the home of the first heart transplant. But I followed that interest, and I would encourage you again to follow the interests that are there. I came and worked in cardiac surgery, found it rewarding, and after a number of years, that's where I've ended up continuing to work in the field and enjoying it with all its challenges, being part of an amazing team, because it is very much a team-based specialty with a number of other medical staff, as well as all the allied health professionals that give a patient a successful journey through this. And we've got to remember, the bottom line is that we're trying to do our best for our patients. I hope you will perhaps follow that dream, and in the future we'll see you in the field of cardiac surgery.
So there you have it, your semi-quick tour of Cardiothoracic Surgery Department in Royal Victoria Hospital. And I would like to thank my colleagues and consultants for helping me make this video. And for my parting message, if there's anything that you think you like or enjoy, I would say put your mind, heart, and effort to it, and you will surely get there. And that's it. Have a good day. Bye.